As a resident of Fremont and a member of the medical staff of Washington Hospital for nearly 30 years, I am outraged by the unfounded and baseless accusations made in the so-called documentary Life for Sale. The allegations made in the film do not reflect the reality or the opinions of the physicians and caregivers at Washington Hospital. As a former chief of staff of Washington Hospital, I can say without reservation that the hospital, its administrators, nurses, and other caregivers, as well as my physician colleagues, function under the guidance of the patient-first ethic. Simply put, all decisions at the hospital begin and end with the patient's well-being at the center of the decision-making process. As a physician, I decide when the time is right for my patient to be discharged from the hospital. I do not abdicate that responsibility to anybody else. The medical staff of Washington Hospital is an independent body that grants privileges to physicians to admit patients to the hospital and direct their medical care. Physicians are granted continued privileges every 2 years, provided that the standard of care that they provide meets the highest quality expectations set forth by the medical staff. For those physicians who don't meet this standard, there is a fair process that affords them with the opportunity to defend and/or justify the care they have provided. This process is called peer review. The standards for peer review are spelled out in the Healthcare Quality Improvement Act of 1986. The objective of this federally legislated act is to promote the highest quality of medical care as well as patient safety. The act provides a standardized fair framework for peer review, protects confidentiality of medical information, and affords a physician who is the focus of a review special rights during the hearing. Our patients and their families can have confidence in the quality of care they are receiving as the peer review process, as defined by the medical staff bylaws, provides ongoing professional performance evaluation for all physicians at this and other hospitals. They can also take comfort in knowing that if the level of care ever falls below the highest standards set by the medical staff at Washington Hospital, there is a mechanism in place to ensure a thorough review. Washington Hospital and its medical staff have been providing care to the community for 50 years. The quality of care, as well as the dedication of its caregivers to provide the best possible care, has been a tradition since the hospital first opened its doors. The hospital is regularly surveyed by state and national agencies to ensure that the care is being provided in a safe environment. In addition, Washington Hospital is actively involved in the Institute of Healthcare Improvement's 100,000 Lives and 5 Million Lives campaigns. Indeed, Washington Hospital is a mentor hospital for these quality care initiatives. Finally, I am proud to provide care at a medical institution that is not for profit and community-based. All revenues in excess of operational costs go back to providing expanded programs, screening programs, and health education to the district's residents. This is a hospital that is not only providing excellent care within its walls, but it is also concerned with improving the health of the entire community. Thank you for your continued support of Washington Hospital.